Welcome to Momentum Health4Me. We all need to have some form of cover to help with the cost of our medical expenses. At Momentum, we know that everyone's health and insurance needs are not the same. We have tailor-made solutions to solve for this need, as medical aids still remain unaffordable for a large portion of South Africans. Momentum would like you to enjoy quality, affordable medical care. You now have access to private healthcare cover on the Gold option. By watching this, we hope you will get a better understanding of how your cover works and the benefits you have. GP visits and acute medication. There is no overall limit on the number of GP visits that you can go for at a network GP per year. You do, however, need to have Hello Doctor pre-authorization for every GP visit from your fourth network GP visit onwards. Your network GP visits can either be a face-to-face or video call consultation. If you are registered on the chronic benefit, the HIV benefit or maternity benefit program, you will get an additional 2 network GP visits per year that do not require Hello Doctor pre-authorization. Hello Doctor pre-authorization can be done via the Momentum More Health app or via USSD. Hello Doctor will have a telephonic or video call consultation with you, and if clinically required, authorize an additional network GP visit if a Hello Doctor GP is not able to assist you over the phone. You may visit any doctor on our GP network for GP visits and acute medication. Acute medication is medicine like antibiotics that you need to take for a few days only. Your GP can prescribe medication for you from a list of approved medicines called a formulary. Your GP will either dispense the medicine to you after your consultation or give you a prescription that you can take to a pharmacy to get your medicine. You can go to any pharmacy, but we do suggest that you go to a Dis-Chem, Clicks, Medirite or Pick n Pay pharmacy, as other pharmacies might charge an extra fee, which you will have to pay. Your network GP may also send you for basic blood tests and black and white X-rays, and may also perform minor medical procedures as part of a consultation in rooms, such as stitching of wounds and nebulization. We will pay the account if the doctor is on the GP network, and if the blood tests and X-rays or minor procedures are on the approved list that we cover. Hello Doctor. Hello Doctor offers you easy-to-understand health and medical services, letting you talk to a GP in any language, anytime you need to, for free. Hello Doctor consultations can either be chat, phone call or video call consultations. A Hello Doctor GP may also prescribe medication for you from a list of approved medicines called a formulary. If a Hello Doctor GP has prescribed medication for you as part of your consultation, you'll be able to collect your prescribed medicines from your nearest Dis-Chem, Clicks, Medirite or Pick n Pay pharmacy of your choice. Hello Doctor consultations may also include referrals for pathology and radiology, according to the applicable Health4Me pathology list or Health4Me radiology list. If you need to speak to a Hello Doctor GP, simply dial *120 *394 *120 hash from your cell phone and choose the relevant option to ask a doctor to call you. A registered GP will call you back within an hour. You can also request a Hello Doctor callback via the Momentum More Health app, which you can download from the App Store, Google Play, or the App Gallery on your cell phone. The Hello Doctor helpline is available during business hours if you experience any technical problems. You can find the Hello Doctor helpline in your member guide under Hello Doctor. How should you register for the Hello Doctor benefit? You will need to contact us and provide us with your cell phone number so that we can register you for the Hello Doctor benefit and send you your unique username and password. Chronic benefit. Chronic medication is medicine that you need to take daily on an ongoing basis. If you have any of the 27 chronic conditions listed in your member guide, you will have access to the chronic benefit. If you are already receiving medication from a state facility for your condition on a monthly basis, we suggest that you continue to get your treatment from state. This means that you would not need to re-register on the state chronic benefit program if you ever stop your benefit cover. How should you register for the chronic benefit? You will need to visit a network GP. If your GP diagnoses one of the 27 chronic conditions, they will need to contact us to register you for the chronic benefit. They can do this by completing the chronic benefit application form and sending it to us. We will review the request from your GP and we will tell your GP if we need more information, such as blood test results, before we can confirm your benefit. If we approve the benefit, your GP will give you a prescription for your chronic medication according to an approved list of medicines. Where can you get your chronic medication from? You need to fax or email your prescription to MediPost Pharmacy and then call them to let them know where they must deliver your medication every month. You can refer to your member guide included in your welcome pack for MediPost Pharmacy's contact information under the Chronic Benefits section. We can only pay for chronic medication if we have approved it and if your GP has prescribed it from the approved list of medicines. You will need to get a new script from your network GP every 6 months and send it to MediPost Pharmacy. HIV benefit. You may go for one HIV ELISA screening blood test per year at a network GP. If your screening blood test result is positive for HIV, your GP will need to contact us to register you for the HIV benefit. The HIV benefit also includes a post-exposure prophylaxis treatment to prevent HIV infection in the event that you are accidentally exposed to blood or fluids from an infected person or by any other means. How should you register for the HIV benefit? Your GP will need to contact us to register you for the HIV benefit. They can do this by completing the HIV benefit application form and sending it to us. We will review the request from your GP and we will tell your GP if we need more information, such as blood test results, before we can confirm your benefit. If we approve the benefit, your GP will give you a prescription for your HIV medication according to an approved list of antiretroviral medicines. Where can you get your HIV medication from? You need to fax or email your prescription to MediPost Pharmacy and then phone them to let them know where they must deliver your medication every month. You can refer to your member guide included in your welcome pack for MediPost Pharmacy's contact information under the HIV benefits section. We can only pay for your HIV medication if we have approved it and if your GP has prescribed it from the approved list of antiretroviral medicines. You will need to get a new script from your network GP every 6 months and send it to MediPost Pharmacy. If you are already receiving antiretroviral medication from a state facility for your condition on a monthly basis, we suggest that you continue to get your treatment from state. This means that you would not need to re-register on the state HIV benefit program if you ever stop your benefit cover. Specialist visits. If you need to see a specialist, you must first visit your network GP, who will give you a referral letter. You will need to contact us on the number provided on your membership card to get authorization. You have cover for 2 specialist visits per year. The maximum amount we will pay per visit is 1,220 Rand with a maximum for the year of 2,440 Rand for you and your family if they are also covered. This amount is for the visit or any medication that the specialist prescribes. The specialist may also send you for basic blood tests and black and white X-rays. For example, let's say the specialist charges 1,300 Rand for a visit. The specialist will send the account for 1,300 Rand to Momentum for payment. Momentum will pay the specialist 1,220 Rand and your benefit left for the year will reduce from 2,440 Rand to 1,220 Rand. You will have to pay the additional 80 Rand for the visit from your own pocket. Maternity benefit. You will have cover for 2 maternity visits, which includes 2 2D growth scans or ultrasounds per pregnancy. You will need to visit a network GP who is certified to do growth scans or be referred by a network GP to a gynecologist. If you do consult a gynecologist, the scan will be paid from this benefit, but the visit will be paid from your specialist visits benefit. Your GP may also send you for pathology tests related to your pregnancy and may also prescribe antenatal vitamins for you from an approved list. Baby Yum Yum will support you with all the information you need about your pregnancy and about being a parent. Baby Yum Yum is the #1 parenting portal in South Africa. Momentum will arrange for a nurse or a midwife to visit you at home to assist you with any guidance you might need after your baby is born. The nurse or midwife will also show you how to bathe, swaddle, latch, and feed your newborn. These visits will take place on the 2nd day and in the 2nd week after you get home from the hospital. You will need to contact us on the number provided on your membership card to register for this benefit. Dental benefits. You may visit any dentist on the dental network. You have benefits for basic dentistry such as fillings, extractions, infection control, and cleaning and polishing of teeth. The dentist will send the account to us for payment. Specialized dentistry such as bridges, crowns, surgical extractions, implants, root canals, gold fillings, dentures, and braces are not covered. If a specified dental procedure is not covered, the dentist will let you know and you will need to pay for it from your own pocket. Optical benefits. You may visit any optometrist on the optical network. You will have cover for 1 eye test and 1 pair of clear standard single vision lenses or 1 pair of bifocal lenses with a standard frame every 2 years. The optometrist will test your eyes and tell you if you need glasses. If your eye test shows a reading of 0.75 or more, the optometrist will show you which frames you can choose from. The optometrist will send the account to us for payment. If your eye test shows that you do not need glasses, a reading of less than 0.75, the optometrist will send us a motivation letter to let us know why the glasses are needed. If the optometrist does not send us the motivation letter, then we will pay for the visit only. We do not cover sunglasses, tinted lenses, hard coating, or contact lenses. Flu vaccination. Strengthening your immune system to protect yourself from flu viruses is important. You can go for 1 flu vaccination per year. You can go to any pharmacy clinic to get your flu vaccination, but we suggest that you go to a Dis-Chem, Clicks, MediRite, or Pick n Pay pharmacy clinic, as other pharmacies might charge an extra fee, which you will have to pay. COVID-19 screening test. If you go for a COVID-19 screening test, we will reimburse the cost of the test. You may claim for 1 COVID-19 screening test per year. Health assessment. You may go for 1 health assessment per year, which includes a blood pressure test, cholesterol and blood sugar finger prick tests, as well as height, weight, and waist circumference screening. These tests will show you the state of your health and if you are at risk of developing a long-term condition. You can go to any pharmacy clinic to do your health assessment, but we suggest that you go to a Dis-Chem, Clicks, MediRite, or Pick n Pay pharmacy clinic, as other pharmacies might charge an extra fee, which you will have to pay. Employee Assistance Program. The Employee Assistance Program provides you with access to professional counseling and wellness services. These services will help you to manage personal concerns that have an effect on your well-being, productivity, and performance at work. Through the Employee Assistance Program, you have access to confidential services in a variety of languages via a dedicated toll-free contact center, including the following telephonic counseling services: Psychosocial counseling services. Professional counselors will help you detect, identify, and resolve personal and health problems that may negatively affect your well-being and your ability to perform at work. This service also provides support for children and teenagers and is there to help them with any issues they may be facing, such as self-image problems, peer pressure, performance anxiety, bullying, depression, or exposure to drugs. Trauma and critical incidents counseling services. You have access to trauma support from experts and professionals 24 hours a day, 7 days a week. Assistance will be provided if you have experienced physical and/or emotional trauma, such as rape, hijacking, child abuse, death or suicide of a close family member, armed robbery or assault, domestic violence, kidnapping, or abduction. Legal assist, credit health, and debt management services. If you need legal, debt, or financial wellness advice, you can get assistance from fully qualified and experienced attorneys, financial consultants, and debt rescue consultants. Managerial support services. If you're a leader or a manager, you can also get support to assist and equip you to deal with challenges you may face in the workplace. Psychosocial counseling, legal assist, credit health, and debt management, as well as managerial support services, are available from Monday to Friday from 8 o'clock in the morning until 4 o'clock in the afternoon. You can find the number you need to call to access any of these services on the front of your membership card. You can also refer to your member guide included in your welcome pack from the Employee Assistance Program contact information under the EAP Services section. Multiply Engage. You have access to Multiply Engage, our free rewards program, which gives you great discounts on big brands like Macro, Nando's, Intercape, and Fly Safair, as well as on the Multiply online shop. Important information. Please remember to always make use of a network GP, dentist, and optometrist. To find out which network providers are near you, you can visit momentum.co.za or do a provider search via the Momentum More Health app. Alternatively, you can contact or WhatsApp us on the number that appears on your membership card or in your member guide, and we will check for you. When you visit a network GP, dentist, or optometrist, please ask him or her to check your benefits to make sure that you are covered for the treatment that you need. You will find the name of your benefit option on your physical and digital membership card included in your welcome pack and welcome wrap SMS. Always make sure that you have your member card with you when you need access to any of your benefits. Please store your card in a safe place and don't give it to anyone else to use. Thank you for watching this video. We hope that it has helped you to understand your benefits. Remember, we're only a phone call away if you need any assistance.